The Central California Regional Obesity Prevention Program is a program of the Public Health Institute. This valuable work is made possible through support from the California Endowment and the Robert Wood Johnson Foundation.
If you want to encourage community members to make healthy choices, you must lead by example.
We're the first farmers market in the state of California to operate on a public health department site.
It was the first step in a multi-pronged approach to create a healthier Kern County.
In 2007, I approached the director and I said, we need to do something here at the public health department. We're an agency who tells people to eat better, but people are saying to us where should they go? Our agency is located in an area of high fast food restaurants and convenience stores. And so we can no longer be the agency who says we need you to eat better, not provide them the outlet. So we thought it would be win-win if we start a farmers market not only for our staff but for the community, and we kept some of that local produce here before it gets shipped out for our big metropolitan areas like LA or San Francisco. We also want to help the farmers if they're having to drive 4 to 8 hours for one market like in LA. We want to keep it here locally and make a couple markets for them one day. But it really was to make a change in access to healthy food at the public health department. We are the Department of Health. We're commissioned to protect the public's health. This was one way to do it.
The Kern County Department of Health Services partners with the Central California Regional Obesity Prevention Program on various activities, such as the farmers market. And while the health department site was certainly popular for residents living in that neighborhood, it was vital to the health department and CROP that the access to healthy foods expand. There are now 3 additional grant-funded sites, one in Central Bakersfield, one in Oildale, and another in Delano. Reaching the rural or distant communities is key for improved health.
The environmental change was bringing farmers markets into areas where it was difficult to access fresh produce. And so bringing CROP in from that environmental change side, saying, well, let's bring a farmers market into areas where there's quote-unquote what they call food deserts, where there's not a lot of access to like grocery stores and whatnot. And so there's that environmental change aspect of it, and that farmers markets can bring that into the community.
When shopping choices are limited in smaller rural communities, there is a direct challenge in accessing fresh fruit and vegetables. The irony is that these communities are completely surrounded by agriculture, and they frequently have the fewest resources available to access fresh produce.
To pocket these farmers markets in areas of need, low-income communities, I should say, we feel it would be very beneficial to clients, or the community, I should say.
At the farmers market, both WIC and EBT cards are accepted, allowing the family or individual's purchase power to go farther while ensuring they are selecting the most nutritious food options.
If the farmers market's closer, then why not go to the farmers market and pick up that produce? And if you're on assistance, why not be able to use that there at the same time?
With the seasonal nature of farmers markets, at times it can be a bit hard to help get them started. But the value far outweighs the initial struggle.
I think roadblocks are always going to be there, but I don't give up just from the challenge of that. If I know that we can make a difference in a community, and if the farmers markets help them, we'll continue to do them.
It's all about making easy and convenient opportunities to establish healthy habits.
Eating healthy is just a better way of life. If you start off really young with the kids, that really trickles upward, I think, to the parents. I think kids have an amazing way to kind of nudge their parents to maybe we should be doing the right thing.
The Central California Regional Obesity Prevention Program helps to create healthier communities in California's San Joaquin Valley that support healthy eating and active living. CROP is among a growing number of programs in the nation who use a policy and environmental change approach to help community members gain access to healthy food, beverages, and safe places to be physically active. The Central California Regional Obesity Prevention Program is a program of the Public Health Institute. This valuable work is made possible through support from the California Endowment and the Robert Wood Johnson Foundation.